Let us get into the role of each palliative team involved. Doctors, it's their role to assess the patient and give diagnosis and management to this patient. They'll write treatment and investigation of this patient or care plan of the patient even after they have left the palliative center. Nurses, it's their role to give treatment, also to assess and implement what has been written by the doctor. Nurses are the strongest team here. They're the one who coordinate the entire team. They're the one who will know what the patient needs. They'll bring in the other team like dietitian, doctors, therapists, religious leaders. They coordinate. They also ensure that the patient gets the investigation done, and the families are also coordinated, are part of this management. Together with the doctors, nurses also help to teach and empower the family members. Therapists, we have several therapists under one roof. We have occupational therapists. During illness, there are some of part of our body that will not function normally, like walking will be a problem. Other organs or other part of the body needs occupational therapists to come in and help us rehabilitate or habilitate ourselves. This is also where physiotherapists come in, like helping the patient come back to normal life, walking around and giving assessment of this patient and how the patient is improving. They also speech and language therapists, depending on the type of condition you are having. Some of our speech are affected or language is affected. This is whereby the team comes in to help patients coordinate with the doctors, nurses, and also family members, and also help the patient regain their speech and language back. We also have music and art therapists. They are able to know what the patient needs most. It's very important. Some patients just need to be socialized, to be around somewhere that is organized with music to help them forget most of the things, and that's where this team comes in to help a lot. Not only music, but there are also other things this team does. There are also dietitian, depending with the condition you are suffering. There are some of the diet you are need to have. They'll come assess the condition of the patient and prescribe the correct diet needed at the time and even after discharge from the palliative center. That's the work of dietitian. Also, we have spiritual leaders. When you are sick, or some of the patients when they are sick on their end stage, they usually have problem with their God. They want to make peace with sometimes some of them are feeling like God has left them. Why has God not helped them, or why did God allow this to happen to them? And they also reach a time whereby now they need to make peace with their God. They want to be spiritual. They want someone to help them come back to their God or be closer to God. This is now where the spiritual leader comes in. Also, spiritual leader helps the patient to coordinate with the family members, to encourage the family members, to give them hope during this time, help them with coping. It's not easy when you are sick or when your family member is sick. Actually, this is the time you need someone to be closer, someone to listen to you. We also have counselors. Counselors comes in whereby our family members need to be counseled and also to help them talk about what they are feeling. Same to our patients. They have things that they need someone to listen to. They need counseling. They need to be taken care of. That's this team comes in hand during this time. We have psychologists. They work hand in hand with the nurses, with the doctors, to help us identify some of the problem that we are not able to pick as medic or the other team. It is very important, and we work on. There are also other team members that I can't mention all of it, but as we have mentioned, the entire team, it works as one thing, coordinated by the nurses, They're the one who are close to the patient. They're the one who will tell the doctor exactly what the patient needs, and the other team. It is very, very important for us to work as a team to ensure that our patient gets the best.